I think although most of my friends would be understanding, and I don't think they would treat me any different, I just want to keep it separate. I just feel like that, and also I worry that if I get too comfortable, then I'll start doing it in front of them, and then I won't have that relief when I go out with them.
Amy is a 19-year-old student from South Wales. We've agreed to protect her identity as her friends don't know she has the condition. She's suffered since the age of 11, and it affects her mainly at home. Amy deals with her obsessions by chanting random words and phrases.
I have obsessional thoughts, so if I see something I don't like, something bad on the telly, then when I think of that, I have to stop and do my compulsion, which is just like a string of words. It changes every now and again. I don't know how they come about, but they do. They just come about. When they feel right, I have to stop and I have to do them. Sometimes out loud, sometimes in my head, just till I feel that I've kind of neutralised the thought. But the thing I worry the most about is that if I don't do that, then something bad is going to happen to maybe somebody I know.
Amy's OCD affects many aspects of her life. Intrusive thoughts can stop her functioning, a state known as getting stuck, many times a day.
I have quite a few issues with clothes. If I haven't worn something, and it can be anything, shoes, clothes, for quite a long time, then I feel like I can't wear them again. I have real trouble putting them back on. If I remember that I've been out in an item of clothing and I haven't had a good time, or something has happened that I haven't liked, then I feel like if I put it back on again, then something bad is going to happen. I used to always get stuck in the bathroom really bad. So when I go in there, thoughts come in straight away and I have to stop and do my compulsions and then carry on. And, that can take a really long time.
OCD is a recognised mental health condition, categorised as mild, moderate or severe.
In order to get a diagnosis of OCD, it has to be interfering with your life. So mild, it means that it's making your life difficult and it's spoiling things and making it hard for you to do the things you want to do. At the severe end, it's completely debilitating, so that the person is unable to do anything else.
Recommended treatment for OCD is cognitive behavioural therapy, a talking therapy designed to help sufferers change the way they think and then the way they behave.
If somebody has OCD and they take it to their GP, what should happen to them is they should typically be offered cognitive behavioural treatment from somebody who really knows what they're doing and somebody who's appropriately trained and supervised. If it's severe, they may also be offered that in combination with medication, but what shouldn't happen is that people shouldn't be offered medication alone in the first place.
I remember when I was younger, they used to try and make me pretend to take it out of myself and push it into the ground and stomp on it, things like that, which they used to help when I was younger, but not so much now. We also tried hypnotherapy, which we paid for, but, that didn't do anything. It was about 3 years in when they suggested I should have medication, and at first I was like, no way. But to be honest, I am so glad I did it, because it's probably one of the best things I've done to help with my OCD. It doesn't get rid of the thoughts, but it does control the anxiety.
Good CBT, according to the professor, should be up to 16 hours of one-to-one treatment over several months. Each session should be tape recorded and homework set to keep the sufferer on task.
Good cognitive behavioural therapy, in my view, is about helping the person make sense of what's going on with them, what's going on with their OCD, and then choosing to do things differently, choosing to find better ways of dealing with their anxiety and ultimately reclaiming their life. A lot of it is about helping people go back to their dreams, hopes and ambitions as well.
Getting this type of treatment is problematic, especially in Wales. 3 years ago in England, a scheme was launched which trained 6,000 therapists in CBT to improve access. This hasn't happened here. For people with severe OCD, intensive treatment at a centre of excellence is recommended, but these centres are few.
What works, the availability of good quality CBT in particular is patchy, and there are places where people are waiting a long time when what they get eventually isn't necessarily good quality. What happens if that's not enough for someone? And in the system as it is at the moment, people can move up steps. So if the first level CBT doesn't work, you can get referred to more intensive treatment and more intensive treatment. Ultimately, people will find themselves at a centre of excellence. And the problem here is that there just aren't enough of them. And there are none covering Wales.
I fear that in some places, and I have to say particularly in Wales, that people actually never get to the point of being offered appropriate therapy. Because simply there's a shortage of people who are able to deliver that. So there's poor recognition and poor treatment. Now there are some people who of course do get appropriate treatment, but I'm afraid to say it's the exception rather than the rule.
In a statement, the Welsh Government said people do have access to a range of support and care through their GPs, community mental health teams and, where required, access to specialist inpatient care. Other support can include the use of counselling and talking therapies. All the OCD sufferers in this programme have been told about another possible treatment known as psychosurgery. One example of this technique is highly targeted brain surgery for people with chronic mental disorders. It's extremely rare and only offered at 2 licensed units in the UK. One is the University Hospital of Wales in Cardiff. But it's been 3 years since a procedure of this kind was carried out here. Professor Szałkowskis strongly opposes this kind of treatment.
Let's be very clear, psychosurgery has a completely dishonourable history. Over the years, people who've been desperate have been offered and fooled into, I think, having these kind of procedures because of how desperate they were.
But the Royal College of Psychiatrists disagrees. It told Wales This Week, there is evidence for efficacy and safety of modern neurosurgical treatments for patients with chronic severe psychiatric disorders. Surveys suggest that psychiatrists still see a role for neurosurgery for mental disorder for a minority of patients who do not respond to conventional treatments. It's this kind of treatment that's raised the hopes of Robert, not his real name, who suffers from what's known as pure O. He doesn't have compulsions, but spends every day dealing with intrusive thoughts.
Because I'm a person who's got quite a strong religious conviction, and the OCD, it knew what my Achilles heel was, which is my strong belief in God. And it was kind of attacking that with all sorts of horrible thoughts about God and Jesus and Mary and other biblical characters. And for me it caused a lot of guilt and questions like why is this happening to me?
That was 20 years ago, and today Robert's OCD is even worse in spite of numerous drug treatments and support from health professionals.
I don't think I'd be here without medication, but it's very hit and miss, medication is, and yet when I've tried 1 or 2 of the major antipsychotics for this condition, even on a low dose, they've absolutely smashed me into being a zombie. There's no way I'd take them because I can't. There's no functioning or quality of life at all.
Desperate for help after not working for more than 10 years, Robert recently paid over £500 for a private consultation about a psychosurgical procedure. But he's been told he must first undertake intensive CBT. He's now waiting for a decision over funding.
I feel as if I've been a problem in inverted commas to the individuals I've seen over the years, and I think they probably think, oh God, not him again. He's obsessed with his health. You know, an individual like me who just wants to manage their condition, I perhaps realise I can't get a cure for it. I'm not asking for a cure. I just want to be able to function as best I can.
The apparent lack of specialist OCD treatment in Wales is being recognised. Professor Shalkowskis is trying to set up a centre of excellence which could offer help to people from South Wales.
So I'm very keen indeed that we'll be able to offer both standard treatments, but perhaps more importantly intensive treatments and treatments for those people who've not responded to standard treatments in this area.
Only last week, the British Association for Behavioural and Cognitive Psychotherapies debated the situation at its annual conference. Members from Wales are now hoping to lobby the Welsh Government.
Don't give up looking for help. If you feel you have a problem or an issue, don't be fobbed off by any professional. You know, continue to seek help, and you know there must be more help out there than we are receiving. But don't give up, and you're not on your own.